Hi, good morning. My name is Suzanne, and I'll be doing the cardiovascular examination. So, first, I would like introduce myself to the patient. Like, hi, my name is Suzanne, and I'm going to be your student nurse practitioner today doing your physical examination. I would ask for consent that we would video this examination for school purposes. Is that okay?
Yes.
Okay. So of course, I've washed my hands, and the patient is would usually tell us what they're here for. They're here for probably an annual physical exam, and we'd be focusing on the cardiovascular and peripheral examination. So instruction-wise, I would first things, of course, I would while they come in, we'd be checking their blood pressure while supine, and then also sitting down, and then I would instruct my patient if he could lay down. And usually about 35 to 45 degrees, slightly elevate the head part. And then first is, of course, we're going to inspect the neck, and we're going to locate the jugular vein. So checking for its pulsation. You can't really palpate it very well because it's very deep. So checking where you see the palpation, right there. And then using a flat object, you would, where you see the pulsation, and then using a measuring device. So horizontally and from the sternal notch, you would measure for JVP. So, okay. See it right there. And for this patient, it's about 1.5 for the patient. So after checking the jugular vein pressure, JVP, then we would inspect or palpate the carotid arteries. Of course, we will palpate on both sides. So we start with the left. So there should be no thrills or like cat purring. There. And also on the left side, you also do on the left side. So after checking the carotids, then we would move on to inspecting of the patient's chest wall. The patient does not agree to take off his shirt, so we're not going to do that. So chest wall abnormalities, making sure that the sternum is midline, and also checking for apical impulse if you can see them. So it also depends if the patient is there's a lot of fatty tissues or musculature, you might not be able to easily see it. So also for precordial pulsations and ventricular pulsations, so by checking on them. And then after that is we're going to go to pulsation. So we're going to palpate the aortic area on the right side. Yes, aortic, pulmonic, the Erb's point, the apex of the heart, or the mitral valve. So it would be for the aortic, so it would be the second intercostal space, sternal border on the right side, and then pulmonic, on the left second intercostal space on the sternal border, and then you move to the third intercostal space, fourth intercostal space, fifth intercostal space, which is going to be your Erb's point, and then moving to the left mid-clavicular area, fifth intercostal space will be the mitral valve, or the usually also the apex of the heart. So when checking also for a point of maximal impulse or intensity, it should also be on the fifth intercostal space, mid-clavicular area. You can also ask your patient if you can turn to the side, to your left side. And then you can also check, you can much feel it better if you ask the patient to turn to his side. Okay, and then please lay flat again for me. So that would be palpation. You would also, while doing this, you would want to palpate everything. You're also going to palpate for the abdominal aorta. So you're going to look for the patient's umbilicus, so at least about 2 inches up. You should be able to feel the patient's abdominal aorta, and there should be no thrill. Okay, and then after palpation, we're going to go to auscultation. We're going to auscultate all the four all 4 areas using your as I forgot to mention, while checking for carotid pulse, auscultating them, you're going to use of course we're going to use the diaphragm and the bell of the stethoscope. So I'm going to do the auscultation all together. Also on the right side, also using your bell. Okay. So now let's move on to the heart. So again, for your right second intercostal space, you're going to listen using we're going to start with the diaphragm for the aortic valve. Close to the sternal border, aortic, left second intercostal space, sternal border for pulmonic, and then move to the third intercostal space, fourth, fifth, that's the Erb's point, and then the left mid-clavicular area, fifth intercostal space, or PMI, or the apex of the heart. So you would also do the same thing using a bell for the pulmonic area, aortic, pulmonic. When while listening, you want to listen for any, of course, normal heart song, you should be hearing the S1 and S2, or any abnormalities like the S3, S4, or a splitting S2, which is usually heard when the patient is taking inspirating or on inspiration, and it's usually the pulmonic and the aortic valve should be closing together. So usually if they do not, you could hear a splitting S2 sound during inspiration, wherein the pulmonic valve and the aortic valve do not close together. So 3, third intercostal space, the fourth, the fifth, and then the mitral valve, or the apex of the heart, at the mid-clavicular area, fifth intercostal space. Okay, so that will be auscultation, and of course you would also auscultate for your aortic, abdominal aorta using your bell. There should be no bruits that you can hear. Your diaphragm, and then of course your bell. And also you can listen for the iliac arteries on both sides, the renal arteries, using also your bell and your diaphragm. Okay, and that ends our the cardiac examination. Now let's move on to the peripheral examination. So for the peripheral examination, of course, you're going to first do some inspection. So inspection, where usually I would start with the upper extremities, touch the patient's skin, make sure the warmth is okay, there's no tenderness, also on both sides, okay? And also checking for fingernails, for any clubbing, or checking for capillary refill. Okay, and after that, you would be also palpating the radial pulse, palpating the radial pulse on both sides and also the brachial pulse. Oh, right here. Okay. And also before doing that, I forgot to do the checking also for the femoral arteries. So palpating them and also auscultating using, of course, your stethoscope, using, of course, your bell, and again your bell and your diaphragm. So of course, usually in a true examination, you would lower down the shorts or the clothing of the patient, but our patient will not agree for us to do that right now. So after that, then I said we do the inspection, the peripheral examination, checking for warmth, skin color, any clumping, any what do you call that? What is it called? The capillary refill. And as I said, we check for radial pulse on both arms and also the brachial pulse. And then we move on to the extremities. So of course, same thing, we would be checking for any signs of varicose veins, any pain, like we can check for Holman sign, or and you would flex the patient's foot, and then usually their calf will be painful. So there should be nothing tender, any rashes, skin issues, or anything like that. Also checking for capillary refill on the foot, on the toes, and then also checking for pulses for the dorsalis pedis on both sides and the posterior tibialis. Okay, and also checking for the popliteal pulses. So you would ask your patient to And then I also forgot to mention, while doing your cardiac examination, you would also listen to heart sounds while the patient is sitting. If you can sit up for me, just sit up. So while the patient is sitting and listening to all of the points, the aortic, pulmonic, the Erb's point, and then the mitral valve, and also you would ask the patient to lean forward. But I would do that as well. You would ask the patient, listen while the patient is sitting up, and listen to heart sounds. Some will not be easily heard while the patient is supine, so you also want to do this. And also you can ask your patient to lean forward. Not too much, sir, just enough. And you can easily listen to the point of maximal intensity. Okay, and that ends up my physical examination for cardiovascular and peripheral. Thank you.